Okay, so we're getting ready to sit. Our attendees are starting to join. If you can see at the top of the right-hand panel, we're rapidly growing our attendee list. So I'll just give it a minute for that to, until we think we've got everybody with us, and then we will get started. We're up to about 200 so far. So this is the second in the series of webinars that we're running from the Nuffield Council on Bioethics. We're hoping to have more, probably once every fortnight, on a number of different issues related to COVID. We're still gathering attendees, so please just bear with me for a minute until we think that we've got everybody in the room, so to speak. Okay, I think we can get going. The number of participants is now well over 250, and there may be more still to join us. But thank you very much for joining us today. I should just say to those attending, because we've got so many, you'll not be visible or audible during this webinar. You can raise questions. If you do that through the Q&A function at the bottom of the screen, we will gather those up and relay some of those questions at the end of the presentations. We will also gather them up later and see if we can summarize them in the written report of the webinar that we will put online later, together with the recording of this. We've also got today captions running, so that anybody who has difficulty hearing, you should be able to see the text at the bottom of your screen in captions. So this is, we're co-hosting this. I'm Hugh Whittle, Director of the Nuffield Council on Bioethics. We look at ethical issues arising from developments in biological and medical research. There are a number of challenges that arise from what's happening with coronavirus and COVID-19 that we want to open up and think about and examine. Today, we're co-hosting this with our friends and colleagues at the Ada Lovelace Institute. Carly Kind, Director of the Institute, is with us, and I'll hand over to her in a moment. One of the big questions at the moment is how we move from the current state of lockdown, as it's often referred to, towards what looks a little bit more like normal life, and what kind of data-driven technologies might assist in moving towards that, and what some of the issues might be around that, including questions about privacy and what kind of stage processes this might lead to. This will have to be done in ways that are open, clear, and will inspire public trust. Still leaves a lot of questions. I'm delighted that we've got Linnet Taylor, who's in the Netherlands, and in particular Rupeng Li in Wuhan in China, where they've experienced some of these issues a little way ahead of the rest of us. But first, I'd just like to hand over to Carly Kind from the Ada Lovelace Institute, who are more specifically focused on questions of data and AI, not just in COVID, but more generally, and give us an idea, Carly, of the kind of issues that you think it would be useful to flesh out today. Thanks.
Thanks, Hugh. So, hi everybody, thank you so much for joining us. I hope you are all keeping well in these difficult times. The Ada Lovelace Institute is a research institute with a remit to ensure that data and AI work for people and society. And we have been spending the last 2 weeks doing a rapid evidence review on the technical considerations and societal implications of using technology as part of the transition from the current crisis. So we know that in many countries around the world, governments are considering how they might be able to use technology to understand the disease, the coronavirus disease, to begin to understand its spread and to stop its spread, and to rebuild the capacity of health systems and of our societies more generally as we move out of strictest lockdown measures. And there are different technologies under consideration. There in particular, and those which have received the most amount of attention in the media, digital contact tracing applications, symptom tracking applications, and we're really at the start of the conversation on this, immunity certification. And in that context, there is some discussion about digital immunity certification technologies. And the Ada Lovelace Institute has decided to do a review of the evidence surrounding these types of technologies and an initial scoping of what the societal implications of their deployment might be. We've commissioned a group of, we brought together a group of 20 or so experts last week on a workshop to discuss these, and we've drafted a report which will be published on Monday, which is called Exit Through the App Store, ? And really looking at, should we be using technology to transition out of this crisis? And if so, how we should use technology to ensure that it has the optimal benefits for society and to minimize any risks and negative implications. And out of that review comes a number of findings, and I won't go into them now because I want to hear from the speakers just like you do, but I think the chief one is, at this stage, we feel there is not sufficient evidence to support the widespread rollout of digital contact tracing. In particular, there are a number of technical limitations to various proposals on the table, as well as deep social risks of deploying digital contact tracing, such that it warrants some pause in current plans, at least here in the UK, to roll out digital contact tracing technologies. We also find that the evidence on immunity testing is not yet at a position or hasn't met the threshold to warrant any widespread regime of immunity certification that might rely on immunity testing. And in general, we call for more transparency from government, a greater, wider range of perspectives being fed into government decision-making, a culture of working in the open, and more accountability mechanisms before these new technologies are deployed as part of the transition from the crisis. I'll stop there and I'll hand back to Hugh, who will introduce our first speaker. We will be publishing our report on Monday, and I look forward to sharing it with you all then.
Thanks very much, Carly. I won't take too much time introducing the speakers. You can see details in the registration pages on the website. But first, we'd just like to hear from Linnet Taylor, Associate Professor at Tilburg Law School in the Netherlands. Linnet.
Thanks very much, and welcome everyone on the call. I think the reason I was asked to participate today is because I work on a project called Global Data Justice, where we try to figure out what ethics-based and social justice-based framework for governing data worldwide would look like. So what we try to do is look at how data technologies are playing out in different places and how the data that goes into them, comes out of them, is affecting society. So based on that, my point of view on the topic for today is that we're in a situation where we're seeing a lot of policy-based evidence emerging rather than evidence-based policy. This is because we're working in a state of profound uncertainty with very thin knowledge of the accuracy of the data that we have to work with. I think this is true for epidemiologists, for policymakers, for the mathematicians doing modeling. It's a very tough time for everybody to draw conclusions that they can really stand behind. We're seeing scientists be fairly balanced and clear about that, but we're seeing that when stuff gets translated into policy, there are radically different effects around the world. And that's something we can learn from right now. I think when we add data analytics, whether in the form of trying to do identification of people who are thought to be immune, or when we're doing contact tracing, when we're using any kind of app or data analytics service for something that has huge implications for our civil and political rights, the kind of analysis the Ada Lovelace Institute has been doing is really important to place front and center. This is because cultural differences around the world are going to create different kinds of evidence, which governments are going to have to weigh. And the diversity question is really important here. So for instance, we're seeing already face masks are believed to be radically more effective in some places in the world than others. This is not true. There is some kind of underlying truth about whether we should all be using face masks. We don't know what that is right now, but it's affecting policy. Also, extreme forms of social control, exerted partly through technological surveillance, as we've seen, for instance, in China, will show that that has an effect. Whether it's the kind of effect we want to adopt is a question we need to be really judicious in thinking about. Proxies for calculating infection risk, you know, how far you are from somebody who's thought to be infected, how much time you spend around somebody who's thought to be infected, are really problematic right now. If we adopt apps that use those proxies, they will definitely have an effect. We shouldn't confuse that with being right or accurate or solving the problem. Because as the epidemiologists are saying, this is not a problem that can be solved. This is a state of the world which needs to be addressed in a continuing way. So in a way, we're talking about governance of the entire problem rather than solving anything. So the things we know about this. First is that any tech right now cannot really be described as meaningfully accountable on a democratic level. This is problematic everywhere in the world. We haven't built a culture of keeping technology accountable. We've built a culture of exponential growth in technology industries and pumping money into the sector to create innovation. This is fantastic for economic growth. It's not so great when we want to place our health and our civil and political liberties potentially in the hands of technology developers. It's very important not to do that. We want to avoid a hackathon approach to this, which is what we're currently seeing, I would say. Every research group in the world doing tech has, particularly computer science, obviously, and engineering, has piled into this problem. Some of them are producing brilliant ideas. Some of them are not. For all of them, the data is inadequate, and we need to bear that in mind. They're working with the same data everybody else is. So if we want to make government through technology, which is, I think, what we're talking about right now, accountable and safe, we need to do several things. First, we need to be honest about the gaps in the data in an ongoing way. What do we know? What do we not know? And we need to be transparent about that. What mechanisms do we have for making sure that things are not being built based on inaccurate data or data which has become understood as inaccurate since the tech was built? Second, we have a history of function creep and security theater. Back when we could get on planes, we had to do a lot of things like taking our shoes off, you know, which were responding to previous emergencies, but didn't actually have any relevance to the current state of affairs in terms of security. It's very likely we're going to see this happen with apps and with tech in general in this crisis. Having stable technological ways to address this problem is going to become a way to manipulate people's perceptions of the safety of going out of the house, of going back to work, of letting their kids go to school. It's really important that the kind of provisions for accountability that the Ada Lovelace Institute is asking for should become concrete. Third, I think we need to complement structuring our actions through technology with structuring of protections. We don't have structured protections against irresponsible technology right now. We have data protection. It's not enough. Data protection aims at personal data. A lot of the technologies we're talking about right now are not completely to do with personal data. They're to do with the larger group issues of civil and political liberties. And we need to be clear about which we're thinking about and whether we're addressing both of those levels. Personal data is not enough here. So we need checks and balances where we have a meaningful role of civil society organizations in protecting privacy, civil and political rights, and also in ensuring representation. This is another thing that Ada Lovelace Institute has stipulated, is that we need actual representation of different groups in the governing of these technologies, which we don't have currently. Policymakers make policy in their own image a lot of the time. We see lockdown, isolation, even hand washing being demanded of populations around the world who don't have the opportunity to do that. We see a lot of talk about smartphones when we know that 50% of the world doesn't have one. And if they did, they wouldn't have the connectivity to use it. So we know that some solutions will work some places, others will work other places, and we need to be conscious of that. Finally, I think we need to balance this problem of centralization and decentralization, because good privacy technology, good privacy preserving technology decentralizes data. It keeps it on your phone, it keeps it away from central authorities. Good government does the opposite. It centralizes good information with government and allows government to act judiciously to solve problems. This is going to be a conflict, and we're going to need organizations that can broker between those who need information centralized and those who need it to be decentralized to protect us. This is going to be a political problem that we live with over the long term with regard to epidemiology. And so I'm interested to see what we can do about that. And finally, that no tech solution should be seen as a political solution to anything. We remain in a state of vulnerability no matter what we do. And the idea that tech can actually realistically protect us is something more dangerous than bad politics or bad government, I think. Thank you.
Thank you very much, Linnet. We're picking up some questions already. Thank you very much for that. We'll gather them up, some of them a little bit later. But first, can I ask Rupeng Li,
yeah.
bioethics at Huazhong University in Wuhan. Rupeng, thank you so much for joining us.
Yeah, it's a great pleasure to have this chance to communicate with so many audience, online in the online meeting. But what a pity! I just had an operation, and on Tuesday, and I still in hospital, so video communication is not convenient for me. So I just for this audio communication. So this many thanks for the chair and for the very enlightening talk and presentation given by Linnet. So because I'm in Wuhan, so I just want to share some experiences in Wuhan. We got through from this very tight lockdown. And regarding this topic of this online meeting, so I'd like to share some experiences and status quo of health code in China, and then give some preliminary thinking on ethical issues raised by. So firstly, this is status quo of health code in China. So it was said that the COVID-19 epidemic has been basically controlled in China. Meanwhile, the work, production, and schooling have to begin to be restarted, and the revival of human normal life and the national economy is greatly expected by so many, Chinese people. So at this moment, an invention and its products have been widely used. On February 6th, a leader of Hangzhou city, located in Zhejiang province, proposed that in order to help enterprise to restart work with playing to advantages of its digital economy, to establish a unified digital declaration platform, including personal electronic health codes and timely data sharing. And soon after the intervention, CCTV News featured the Zhejiang Health Code, a product of working together by Alibaba company and local government, a new type of public-private cooperation. And so all the provinces soon wanted their own version. And the health code in China, this is in the information collection stage of the health code. It requires the user to declare the real information, including name, sex, mobile phone number, ID number, detailed address, activity track, health information, contact history, and so on. In addition to the information reported by users, the health code system is also connected with the traffic data of civil aviation, railway, highway, as well as the traffic data within the city, such as buses, subways, and also data of telecom operator and payment data or bank. The use of the data through real-time comparison update and comprehensive analysis of big data can cross-verify the information declared by users, accurately grasp the movement, trajectory of citizens, and accurately identify high-risk groups. So the health code in China featured as different colors. Now we have 3 colors. Those with green colors are able to travel freely, and the yellow codes should self-quarantine for a week, while red codes must spend 2 weeks at home. So enforcement varies dramatically by region and even neighborhood, because till now we don't have a unified health code in the country. And also with this health code for different city, and also has a kind of one-day pass for whom has green code and the temperature checked normal. And when you enter into, for example, a supermarket or a hospital, so this is the health code plus is a one-day pass. So it's you know, it's varied in different provinces. And actually, health code, you know, now applied in China has its legal basis. The law on the prevention and control of infectious diseases and the regulations on public health emergencies stipulate that in the process of epidemic prevention and control, the government, the Department of Health, CDC, and healthcare institutions have the power to collect personal information for the purpose of epidemic prevention and control. Individuals have the obligation to report personal information such as ID card, address, health status, contact history, and so on. And the relevant department and agencies have the legal basis to change the purpose of information use. So I just read the published paper by Michael Parker on this topic. It is, I think, till now, this kind of mobile phone apps are highly successful in not just in China, I think in East Asia and Southeast Asia with this kind of apps and combined with intensive testing programs. So I think this data-driven technologies have its merits, you know, together with this quarantine and isolation contact tracing is effective measures to delay the epidemic. It's different from standard contact tracing measures. It's kind of this kind of rapid and instantaneous contact tracing. Because this is a problem for this COVID-19 pandemic, because it's for contact tracing, it's difficult. Around 50% of transmission happen early in infection and before symptoms start and before test results can be acted on. So I think this kind of emerging technology has its merits. And in Wuhan, till now, no new suspected cases and no existing suspected cases. And also the whole city, after this tight sealing off and lockdown, is gradually and steadily restarted. For example, you know, public transportation and, you know, this is production and so on. So I think, you know, this kind of technology have its merits, but till now, this is a potential threat emerging. It's an asymptomatic infection. And according to the statistics, till April 15, a total of 1,032 asymptomatic infected patients are still under medical observations. So this is supposed a new, is a potential threat for this control and prevention of this COVID-19. So this technology, I think, has its merits and also some ethical issues raised by. Someone said, maybe asked or doubted, is it a sword of the Damocles hanging over my head? So for me and my colleagues, it is a little bit troublesome, but it is not a sword. So what are issues? In my opinion, informed consent and privacy are seriously connected by concerned by Chinese public. According to a survey, 16 health codes in 14 provinces and cities at the time when the user applies health code, there is no user agreement and privacy policy except Shanghai, Shandong, and Guizhou. For the National Health Code, National Government Service Platform, the applicant is required to click to express consent to the user service agreement and privacy policy when registering, in which it is clearly specified that which information will be used, only used for inquiring users' health information concerning the epidemic prevention, and it declares to strictly protect your personal information safety and not permit to use the information in health code to do activities to invade privacy. But after the outbreak, Shanghai officials said the health code will be used by Shanghai residents to provide data services for their work, life, and business. Alipay also said health code will be formally associated with Hangzhou electronic social security card and health card and can directly achieve registration, number, medical treatment, medicine, electronic invoice, and other hospital treatment and medical insurance payment. This raises concerns about the invasion of privacy. So I think the major ethical issues is how to balance between personal interest and social good. That's a popular a cartoon in Chinese social media now is human right versus human left. Our answer is we do need human right, and we will definitely prevent human life. The health code offers the potential for important benefit to both society and to individuals, offering the possibility of both reducing the number of infectious cases and also enabling people to continue their lives in an informed, safe, and socially responsible way. There is a room for it to be improved to implement informed consent and protect privacy. We are very glad to know Apple and Google will cooperate to make efforts towards this direction. We believe maybe they, in the future, will be successful to keep balance between the personal interest and social good. And so in pandemic, everybody is possibly a victim and a vector both. I think we need to make this kind of balance in different context and different situation, and also how to interpret and specify the fundamental basic principles and some normatively basic rights. Need to how to interpret and to specify in different contexts, and especially in this kind of global pandemic crisis. And we can draw from it a normative claim. Everybody has a right to be protected and treated when being infected, and also has the obligation to protect others, including providing your health and other related information to the agency for preventing and controlling the epidemic. In Chinese regulations, there are articles which try to keep balance between personal interest and social good. Because of time limit, so I will not repeat the specific article in this kind of regulation. But now I think the problem is how to improve health code and how to keeps a balance between personal interest and social good. It's not an easy job, and also I read, this broadly and deeply reflect on this kind of very complicated and highly controversial issues. For example, the policy briefing by the Ada Lovelace Institute is very deeply and broadly reflection. And I think, the state should accelerate the formulation and implementation of relevant technical standards, unify and standardize data collection, use and sharing, strengthen data scrutiny management, prevent data leakage, and publicize relevant standard documents in a timely manner. And each health code operating institution shall improve the user agreement and privacy policy to guarantee the right of users to be informed and use the data legally and ethically to avoid data abuse. I think that's a urgent task in China, because now we are widely using this technology. And after the outbreak is over, a data deletion mechanism should be established if it is really necessary to continue using relevant data. The purpose of data use should be clearly defined, and citizens' authorization should be obtained. So, so much for this. This is just to share some experience in China and some preliminary thinking on ethical issues raised by this data-driven technology. Thank you.
Thank you very much indeed, Ruping. And I think we've got some questions we'll want to pick up, but can I just, on the last point that you made, which was about how important it will be for data to be deleted once we have passed the crisis. And Linnet referred to the risk of function creep a little bit earlier. I wonder whether, Linnet, you think that this is maybe one of the real risks that we have, is whether the governance systems that we may be able to put in place will be capable of avoiding that continued subsequent use of these kind of, not just the data, but also the mechanisms that are used to manage it.
I think that's a great question. I mean, the GDPR for us Europeans does have provisions about getting rid of data when it's no longer necessary. For large companies which have to report what they're doing with data, those are usually followed. The degree of non-compliance with the GDPR is believed to be very high on the level of infractions.
Yeah.
So I think we should assume that we'll see that happening with this kind of tech as well. Something else that I have a question about is anonymization is currently equated with deletion. You will see in a lot of documentation data deleted or anonymized. In the case of the kind of data we're talking about, these two things are radically different. Anonymous data can be aggregated data. It can be data that says things about groups, about neighborhoods, about particular ethnicities, about particular sexualities. It can be it can be data that says things about gender, about poverty status, about activities. All sorts of things can be done with data that do not involve identifying people. So once you've anonymized data, which is anyway a moving target, technically, that data can be kept forever under current rules. Nowhere in the world does anyone say you have to actually literally delete data. They only say you have to anonymize it. So I'd be really cautious about that.
Thank you. Carly, are there particular questions that you've seen that you think for us to relay at this moment?
Definitely, and I'll just add a quick addendum to what Linnet said, which is complicating that. We, in doing the research we have done, we've spoken to public health professionals as well about the notion of a mandatory time period after which data collected during the crisis would have to be deleted, because I agree with Linnet that there is very little to require the deletion of all data, but only its anonymization. We did have some feedback from public health professionals that the use of data for research over the long term may be incredibly valuable. How can we balance the need to retain data for research purposes given that we assume that this crisis is many years in operation, against more stricter controls on data deletion after a certain period of time? That's still an open question as far as I can see. I've collated some of the questions. I'm going to start with Rupeng. There's a few questions that came up in the chat and also in my own mind around the effectiveness of the health code system. And in particular, Andrew Straight pointed out on the chat that Chinese smartphone penetration is at around 51% in recent years. How does the health code system deal with people who don't have smartphones? How does it deal with children? How does it deal with the elderly? And have you seen yet any studies or evaluations of the effectiveness of the system? Or is it the case that there's a general perception that the system's very effective, but we don't yet have the research to prove it?
Yeah, I got it. I think till now, you know, this is this is outbreak of the COVID-19. So I think we don't have this kind of thorough, you know, investigation and this
Sure.
kind of yeah. But I think now in China, I just mentioned is now no unified national health code. This is health code for different cities. And that's not just this one version for, you know, travel and, you know, for civil aviation and for public transportation. And this is a plus. I won't call it, you know, plus health code. And plus it's a kind of another kind of not electronic version. A certificate. It's a kind of local residential community and a hospital certificate. Because, you know, I got, you know, the two version of this kind of certificate, you know, this health code, and also, you know, you can apply for a local residential community and hospital certificate. And this kind of certificate relying on a daily reporting system. Because, you know, every citizens, you know, in this community, residential community, this is daily reporting your temperature and, you know, your health status, you know, to the community officers. Because, you know, this is very different, you know, in China, from Western society, we have very strong, how to say strong, or maybe this is a community system. You know, we have this, they can, you know, to every, you know, every residence can be, you know, traced and reported, include in this reporting system. And I think this is, you know, not just one version for this electronic version, because for some elderly and they cannot, you know, use Alipay and use WeChat, you can apply for this kind of paper certificate with official stamp, and that's also work. So I think that's the situation in China. It's not just the one, version.
That's really interesting, and it shows how technology can build on, but also has to be embedded on social structures. I wonder,
and you know, it's so very different social structure, and in every community, residential community, and also, for example, you know, I'm in Huazhou University of Science and Technology, and we also have, you know, our university community, and it's kind of a daily reporting system. So that's just, you know, it's a very different social structure, you know,
That's very interesting. Linnet, there's a number of questions that I think are directed at you. A thread that is across many of them, including from questions from Tessa Derbyshire, Maeve Walsh and Gail Cardew, which centers on trust. How can we build public trust in the technologies, in the government's use of data, including in modeling, and in the use of health data, I suppose, in these types of apps? Are there particular kind of recommendations you have on that front?
Yeah, obviously this is a huge question. I mean, trust doesn't come without trustworthiness, for one thing. So demonstrating that privacy enhancing technologies have been used wherever possible is a really important first step. But I think there's another issue here, which is that we're asking tech to be part of government, and we're asking government to make decisions about tech on our behalf in a way that hasn't happened, at least in recent history. This is different from e-government, right? This is life and death for a lot of people. So I think what we need to start doing is seeing tech as something we should take control of the way we try to take control of government. I think that we should start applying some of the same structures for accountability and transparency that we have for government, however effective those are, and we definitely need to make them more effective, to tech as well, which is something completely new, because tech has until now, as I said earlier, been pretty much out there on its own innovating. This is a case where not all tech, but tech that is now part of government and part of governance needs to become under democratic control. And how we do that is a learning process, and I think that the Ada Lovelace report is a great starting point. But I think we need to demand actual legitimacy of technology firms when they act on behalf of government on the population. And that's a completely new framing.
Thank you. And building on that, a question from Richard Pinch was, how can we transform, and potentially building on the discussion around deletion, if an immense amount of value could be created through the collection of data during this crisis, that value could be transformed into commercial value for companies in the long term, or it could be transformed into public value for societies. How can we think about that? Either preventing the commercialization of data or realizing the public value of data collected?
I think everyone on this call is making points about how there is no single answer to any of these questions, that these are contextual questions, and that what we need is meaningful structures for scrutiny of decision-making around these problems. We don't currently have that. And so the questions we're asking are not great questions. We're asking, should we do this or that? Should we build this or that? I don't think we ask that in other areas of life. I don't think we ask, should we build this type of hospital or that type of hospital? We try to see what kind of illnesses people are coming down with, and then we respond to that by building our medical infrastructure. I think we need to ask similar questions of our technological infrastructure. We need to ask, what do we know about these data sets that we didn't know when they were created? What kind of scrutiny does decision-making about them now require? What kind of power does the data confer? Who should get access to it? It's not rocket science, we're just not used to doing it. So we need to develop ways to do it. And we need new governmental infrastructure to do that, including civil society connections to government that don't currently exist. We need new forms of scrutiny and new levels of scrutiny, and we need a new diversity of scrutiny as well. And I think that is one of the challenges we're coming up against right now in a state of emergency when it's really hard to do that. So it's going to require concerted effort.
Is there a parallel discussion in China on this question of scrutiny and everything?
This kind of commercial use of this personal data? Yeah, I think that's a concern in China, because this is now we have a national platform, and also this is the Alipay platform, and also WeChat platform can apply for voluntarily apply for this health code. But this is a kind of new kind of public-private cooperation. So I think, yeah, that's a really concern we should take into account. This kind of how to protect this is personal privacy and personal data for maybe the future commercial use. Yeah. So that's why in the last the last point I mentioned this the how to improve this is technology, this emerging technologies. So, but this is maybe is some dilemmas and some difficulties can be overcome by technology itself. But we cannot to rely on this kind of technical fix to social problem. We should be alert about it, and we need some transdisciplinary experts to establish this accountability mechanisms to oversight this kind of the use of these technologies.
Thank you, Carly. If you don't mind, I'm going to on our behalf wrap up now. We've launched a poll. If anybody is still listening, please respond to the poll to give us a little bit feedback and an indication of what we might do next. I would just like to thank very much indeed my co-host Carly, our speakers Linnet in the Netherlands, Rupeng in China. Thank you all for listening in. Hopefully we'll be back in a fortnight with another thrilling episode. This is difficult times, and I think it's just really important that we keep going, probing some of these questions, and this is all happening in real time. So thanks once again to everybody, and hopefully see you again soon. Thank you.
Thank you so much.
Thank you. Yeah.
Take care.
Take care.
I'm going to leave the meeting running just for a minute because there are still people responding to the poll, but don't expect to hear anything terribly interesting.
But we cannot poll. Why?
Okay, maybe I can...
Because we are not participants. Yeah, so
yeah, I think that's right.
I try to, you know.
Okay, Rupeng, I think that we can agree. It was excellent. It was just the right length.
Yeah, I think it's excellent.
That's the scrutiny.
Yeah.
Well,
Thank you. I'm going to try and get off the call now. I don't usually
Take
use
care, everyone.
Take care. Bye. Thanks for playing.
Okay, I'm closing. We're getting some
Bye.
nice feedback in the Q&A to say it was good.
Yeah.
Cheers.
Okay, I close the meeting now. Thanks.
Bye.
Bye.